Hello, everyone. This is my first topic of discussion, and as the name suggests, budding radiologists, I would start from the very basics. In this session, I want to discuss the vascular anatomy of the mediastinum, but before directly jumping onto the radiological investigations, I would like to start with the gross anatomy, so as to give you all a basic understanding of the location of the various structures within the mediastinum. Before starting, I would like to state that the upcoming images have been taken from Netter's Anatomy Atlas, which I personally feel is a great way of studying gross anatomy. Okay, so one of the most important things in the mediastinum is the heart and the major vessels that are given by it. So we'll be starting off with the major vessels first of all. So these are basically divided into the venous and the arterial system. Okay, first of all, there was a lot of labeling. Netter's is a beautiful book for gross anatomy, and it mentions almost everything there. But just so that we pay attention to the important things that are relevant to the topic that we are studying right now, I have erased the other parts and I have just focused on the parts that I would be talking about right now. Okay, so I'll just orient you first of all. You can see the very dashing Tom Cruise on the top right corner of your screen, and you can see him facing anteriorly, and that's how our patient is basically facing right now. Okay, so we are looking at this section from front. All right, you can see the heart over there in the middle, the lungs on either sides, and the major vessels. So basically the blue thing, which are the veins, are present anteriorly, and behind that the red things, those are present posteriorly. So this is the orientation for this particular slide. Okay, so here first of all, let's start off with the jugular veins and those subclavian veins. We have two internal jugular veins which are draining the brain, and they are coming down from the brain. Okay, so you can see here basically this is the left internal jugular vein and this is the right internal jugular vein. Okay, so now they are coming from the brain, they are getting the blood from there. So now they'll be combined by two other veins. What are these? This is the right subclavian vein, and here this is the left subclavian vein. Okay, so now when it combines, it will form the brachiocephalic vein. So here this one, okay, this is the left brachiocephalic vein and this is the right brachiocephalic vein. Right, so this is an important thing actually. I'll tell you later why. There are two brachiocephalic veins over here, and the left brachiocephalic vein, as you can see here, is crossing from the left side all the way to the right side, and then it is joining with the right brachiocephalic vein to form the superior vena cava, this structure. This is the superior vena cava, which is obviously we know that it is draining into the right atrium. Right, so this is about the venous system. Now let's move on to the arterial system. One thing that you should remember is that the venous system is present anterior to the arterial system, and you can very well see it, clearly you can see it over here. This is important when we'll move on to the cut sections of the chest. Okay, so now starting off with the arterial system, we can see over here, we know that we have the ascending aorta that is given off by the left ventricle. This is the ascending aorta, and then it will form an arch and it will go all the way down. You cannot see it over here because it's posteriorly, and it goes all the way down then into the abdomen and gives its various branches. So the branches that we are concerned about here are the branches that are given off by the arch of aorta. So there are three branches that are given off by the arch of aorta. One is the left subclavian artery. See, the one present right behind the left subclavian vein, this is the left subclavian artery. Then here you have this one is the left common carotid artery, and the third is the brachiocephalic trunk. This here that you can see is the brachiocephalic trunk. It's a trunk because it will further divide into two branches, which are what? The same thing. The right subclavian artery to supply the upper limb and the right common carotid arteries. So basically I remembered it in a manner that, aorta, as we've always imagined and as we've always read, that it's on the left side, right? So it favors the left side. That is why it's giving two separate branches for the upper limb, that is the left subclavian artery and the left common carotid, whereas on the right it just gives one branch, which is the brachiocephalic trunk. But obviously that divides into two later on. Okay, so apart from this, the other thing that we have to remember is the pulmonary trunk. So we know that the pulmonary trunk is given off by the right ventricle. So here, this is the pulmonary trunk, okay, given off by the right ventricle here. So based on this, you can get a rough idea about the chambers also, although we'll be studying that further on. So basically we studied here that this was what, the superior vena cava, and it was draining into the right atrium. So this must be the right atrium, right? And I'll discuss it when I discuss a chest x-ray also, where we study that the right heart border is formed by the right atrium. Now here you can completely, clearly see that the right heart border, if I were to see a chest x-ray, the right heart border was formed by the right atrium, because it is sometimes difficult to imagine that, the complete right heart border is formed by the right atrium. How is that possible? How is it that right ventricle is not contributing at all to the right heart border? But now you can see as to how the chambers are and how they contribute to the mediastinal outline. Then I told you that the pulmonary trunk is given off by the right ventricle. So basically this is the pulmonary trunk. So this structure here must be the right ventricle, right? So in the chest x-ray I would tell you that this base part is formed by the right ventricle, and here you can see it clearly that it's formed by the right ventricle. And then here the aorta, basically this is the aorta, and this is the left ventricle over here, and I'll tell you later on as to how, it's going like that. So basically towards the left side you have the left ventricle, and there are other things also forming the left heart border, which is topic for another time. Okay, so we've read that the venous system is present anteriorly, and the behind that is the arterial system, and behind that we have the trachea and the esophagus. Trachea is this over here. Okay, so mind you, there is just one brachiocephalic artery and there are two brachiocephalic veins. Okay, we just studied over there, so it's important and good thing to remember. Okay, so we'll be discussing the azygous venous system in this slide. I would not go into the depth of the system, only the part that is important according to the anatomical aspect that we are studying under this topic. So azygous venous system, it's a system because it consists of more than one vein. The main purpose of this system is to drain the blood, the venous blood, from the upper lumbar and the thoracic wall into the main or the great vessels like the superior vena cava. Right. So what are the veins that form the system? So basically it is a roughly H-shaped structure, which you can clearly see over here. This is the azygous vein. This is the accessory hemiazygous, and this is the hemiazygous. So basically what is this? This system consists of the azygous vein on the right side and all the rest of the veins on the left, which include the left superior intercostal vein, the accessory hemiazygous vein, and the hemiazygous vein. So now if we were to study each of them briefly, the azygous vein, it arises from the lumbar region, from the abdomen, that is by the combination of the right ascending lumbar and the subcostal vein. It ascends up from the abdomen, as you can see over here. It ascends up and it drains into the superior vena cava. Okay, this structure here is the superior vena cava, as you can see. Now on the left side, let's start with the hemiazygous vein. This is the hemiazygous vein, and this as well arises from the abdomen. It ascends up and it drains into the azygous vein. Similarly, the accessory hemiazygous vein is present up and it drains into the azygous vein. So basically, this is A and this is H. A comes first, so alphabetically, so that is why it's placed up, whereas hemiazygous is placed down. Then the third vein of this system is the third vein on the left side. Total there are 4 veins. Is the left superior intercostal vein. You can see it very clearly from this diagram that this vein, although a part of the azygous venous system, is separately draining into some other vein. And which vein is this? If you see the course, this is the vein that it is draining into. And what is this, as we've studied in the previous slides? Yes, this is the left brachiocephalic vein. Because you can see it clearly over here that this here is the left subclavian vein, this is the left internal jugular vein, and they combinedly form the left brachiocephalic vein. Okay, and from here we're getting the right brachiocephalic vein, which is draining into the superior vena cava. So in total, this is the azygous venous system. The important things to remember in the end are, there are 4 veins, 1 is on the right side and 3 are on the left side. And on the left side, the left superior intercostal drains separately into the brachiocephalic vein, the left brachiocephalic, and the accessory hemiazygous and the hemiazygous, they drain into the azygous vein. The accessory with an A is present above and the hemiazygous is the one present below. And there is a lot of variation as to at what level they are supposed to drain into the azygous vein. So as most of the books say that accessory hemiazygous, it drains at the level of T8 and the hemiazygous at the level of T9. But most of the time, instead of draining separately, like you can see in this image, they have a separate drainage point into the azygous vein. Most of the time they combine over here and through a common channel they drain into the azygous vein. But it's different in different people. Okay, this is just the similar thing that we've studied in the previous slide. It's just a very beautiful picture in letters. Helps us to get a 3D orientation of the things that we studied in the previous slide. So basically here you can see it very clearly, all the veins of the azygous venous system that we had discussed. Let's start with the major vessels first of all. Here you can see, as it is marked, this is the internal jugular vein, and this is the right subclavian vein, this is the left subclavian vein, this is the left internal jugular vein. Okay, now they are both combining to form the left brachiocephalic, and here these both are combining to form the right brachiocephalic, and both the brachiocephalics are forming the superior vena cava, which is right over here. So now we can see in the azygous venous system, we can see over here that this is the azygous vein which is ascending upwards, and it is forming an arch and draining into the superior vena cava. Okay, on the left side we have the other 3 vessels. First is the hemiazygous, A for accessory, so it is present above, and then the third is the left superior intercostal vein. We can see here clearly that the left superior intercostal vein is draining into the left brachiocephalic vein. Okay, the accessory hemiazygous and the hemiazygous vein, they haven't shown a clear channel through which they are draining into the azygous, because I told you there is no clear definition between the two. Here they've shown multiple collaterals and multiple other smaller veins through which they must be draining into the azygous, but yes, they ultimately drain into the azygous vein. Okay, now let's see how the azygous vein is actually present within the mediastinum. I told you that the azygous venous system, I told you that in the azygous venous system, only the azygous vein is present on the right side, and all the rest of the 3 veins are present on the left side. So basically, this is a right lateral view of the mediastinum that we are seeing. To orient you, I would like to first tell you as to how the structures are. So first of all, basically this is the anterior side, so the patient must be facing this side, and this is the posterior side of the patient. Okay, so to help you understand the orientation, we have another handsome man over here, Brad Pitt. So you can see him that he's facing here. Okay, this is his anterior side, and this is his posterior, the back side. So similarly, our patient here as well, this is his anterior side and this is his posterior side. Okay, and we can see that the lateral portion of Brad Pitt which is towards us, this is his right side, right, the right shoulder, and the left is towards that car. Okay, so similarly we are looking at the patient as in a similar manner from the right side, and we've removed the right lung, and now what we see are the mediastinal structures from the right side. Okay, so obviously the structures, all the structures that are present over here, you know, are the ones that are draining into the right lung. Okay, so starting off with the azygous vein, which we can clearly see over here, it is ascending up from the abdomen and it arches. I told you in the last slide that it arches over and drains into the superior vena cava. This is the superior vena cava over here, and this is the inferior vena cava, which gets blood from the abdomen, and it is draining into the, both of these drain into the right atrium. So basically this must be the right atrium. Okay, so now I told you that it arches over. It arches over two structures. What are these? The right main bronchus and the right pulmonary artery. So basically this behind is the right main bronchus, and in front this is the right main pulmonary artery. You have to note here that on the right side, both of these, that is the right main bronchus and the right pulmonary artery, they are present at the same level anteroposteriorly. This is important because it is not the same on the left side, and because of this discrepancy we get a different, anatomy on the chest x-ray of the hyla, which we'll discuss later on. So this is an important thing to remember. Then apart from this, the other things which we can see in the slide are, this is the trachea, this behind that, the muscular thing that you can see is the esophagus, and you can also see the right pulmonary veins. Okay, basically these two. Basically we have two pairs of pulmonary veins, one pair on the right side and one on the left, draining into the left atrium. So these two are the pulmonary veins that are present over here. Okay, now let's look at the left lateral view. Just like we looked at the right lateral view in the previous slide, this is the left lateral view, and I'll give you an orientation of it. Okay, I haven't forgotten the boys who are viewing this video. So I have, a beautiful woman over here, Angelina Jolie, who's facing. This is her. She's facing anteriorly, right? So this is her anterior side, and this basically is her posterior side. So similarly, our patient as well is facing anteriorly. So this is his anterior side and this is his posterior side. So we can see that the lateral portion which Angelina Jolie has towards us, this portion, this is her left side, right? So similarly, the patient's left lateral position is, we are looking at the patient from the left side, and we've removed the left lung, and now we are seeing the mediastinal structures from the left side. Okay, so in the azygous venous system, I told you that it's just the azygous vein that is present on the right side, and rest of the three veins are present on the left side. One of them, which is the accessory hemiazygous vein here, okay, it is this thin vein which is running behind the aorta, and this is the left superior intercostal vein, and we studied its peculiarity that it drains separately into the left brachiocephalic vein, right? So the hemiazygous vein has not been mentioned over here, and apart from this, the other things to note over here are, one of the most important things, the aorta. Okay, then the other two structures are these, which include the left pulmonary artery. This is the left pulmonary artery, and this is the left mainstem bronchus over here. So recall what I had told you in the previous slide, that on the left side, that on the right side we have the artery and the bronchus, they are at a similar level anteroposteriorly, but here you can clearly see that the left pulmonary artery here is above the left mainstem bronchus. And this is important because left pulmonary artery, actually the pulmonary artery contributes majority into forming the hilar shadow on an x-ray. So therefore, as the left pulmonary artery is above the bronchus on the left side, the left hilar appears above the right hilar when we see it on an x-ray. So that is why this is what its importance is. Then apart from that, we can see the pulmonary veins as well. Okay, the left pulmonary veins. And we can see over here this muscular structure behind is the esophagus. Okay, so now we are starting with the cut section anatomy, all right. But before we start off with the cut section anatomy, we need to see as to how we are viewing, the section, from where we're viewing the section. So what makes to the right side, or what makes the left side, and what's anterior and what's posterior, right? So a simple way to imagine that is, you can see over here on the top right corner, a patient is getting a CT scan done, and you can see his face. Okay, his face is towards this side and his legs are towards this side, right? So basically you should imagine it in a manner as though we are looking at the section from the patient's feet side. Now what do I mean by that? So basically here, this is where the patient's feet are. So imagine that you are looking at this section from this side of the patient. So we know that this is the anterior side of the patient, right? And so that means this makes this part, the above part, anterior portion of the patient. Then his back is laid onto the couch. So this is the posterior part of the patient, the back part, right? Now what sides are this? Now this is right side and this is his left side. Fine, you can see it clearly. So in a similar manner, you're looking directly. So this is the patient's right side and this is the patient's left side, right? So now you know that this is the anterior, this is the posterior, this is the right side, and this is the left side. So whenever you view any CT or any MR, this is something that you always have to remember. The most confusing thing is the right and the left over here. Okay, so because our right side is different, but when we are looking on the screen, the right side is different, all right. And now you know as to why the right side is over here on our left hand side. It's because we are looking at the patient from his side of the feet. Okay, so just to clear it up more, I told you that this is the posterior part, and you can see over here the posterior structure, the vertebral body over here. Can you see it? Okay, then anteriorly this bone is basically the sternum, right? So which is present anteriorly. Then we have the right and the left side, which gradually we'll be studying now as to what structures are there within this section. Okay, so now moving on to the cut sections here. So basically I have put this above slide, the anteroposterior view, which we've studied earlier, and we've oriented ourselves to that. So when we have, it'll be easier for us to localize the structures in cut section over here by looking at what we've studied before. So first of all, what we need to know is that the cut sections that I would be discussing about will move from above to down. So basically maybe the first section will be here, then the next section here, then the next section. So basically we'll be moving down like that. Okay, and apart from that, we've already studied in the previous slide that this is the anterior side of the patient, this is the posterior, this is the right, and this is the left. Okay, so similarly this is the right and this is the left side of the patient. Okay, now where is this particular level that I have taken? So this particular level is over here. Okay, So this is the T3 level. So what are the various structures that we are looking at in this level? The first thing that you can see is, we know that this is the left subclavian, this is the left internal jugular. They combine to form the left brachiocephalic, the right internal jugular, the right subclavian, and they form the right brachiocephalic. Then both the brachiocephalics will combine to form the superior vena cava. So this here is the left brachiocephalic, which is moving all the way from the left side to the right side. We had studied before. And this is the right brachiocephalic, and they have to join later on. So if we were to look at these two veins in the cut section, so the left brachiocephalic you can see over here, and I told you the venous anatomy, like the veins are present anterior to the arteries. So here this helps because here it's blue and red, but when you look in a CT, it'll be all the same color. So you have to remember that anteriorly you have the veins and posteriorly you have the arteries. So I have marked the left brachiocephalic. So basically, and this is the right brachiocephalic. Alright, so why is it that the right brachiocephalic is appearing like a circular section and the left is appearing elongated? Because the level at which we've taken, we can see that the left brachiocephalic, it has to cross all the way from the left side to reach the right. So this is what this left brachiocephalic is doing. It is crossing all the way from the left to the right side in order to combine with this right brachiocephalic. Okay, we can't see the combination over here because obviously we are at a higher up level. So this was the venous part. Now what about the arterial part? So you can see the green line that I've drawn over here, the section which is corresponding to the lower image. So you can see over here that we are above the arch of aorta. This is the arch of aorta, right? So we are above the arch of aorta. So above the arch of aorta will be the branches which the arch of aorta gives, right? So what does it give? I told you it gives off three branches. One is the left subclavian artery, then you have the left common carotid artery, and then you have the left brachiocephalic trunk. These are the three vessels. They are present behind this left brachiocephalic vein. Alright, so if we were to see these vessels, so if you move from left to right, you will have first the left subclavian artery, then you will have the left common carotid, and then you will have the brachiocephalic trunk. And you can see that at this section the brachiocephalic trunk hasn't divided at this section into its two further branches. That's a section. If we were to take a section higher than this, then we would see those these two veins separately. But at this particular section we are seeing the brachiocephalic as one trunk. Alright, now apart from that, what else can we see? We know that this is the trachea, right? So the trachea basically is this, okay? And we know that behind the trachea we have the esophagus. So this particular structure is the esophagus. Okay, so it's very easy now. You just have to know this is the right brachiocephalic, the left brachiocephalic. Then you have the three vessels of the arch of aorta, which are the left subclavian, the left common carotid, and the left brachiocephalic. Then you have the trachea. Alright, you have the trachea. So you have the trachea and you have the esophagus. Okay, now let's come on to the next section. We had seen that the previous section was somewhat here, right? Now the next section, and this was the T3 level. Now the next section that we are taking is just below this, which is the T3-4 disc level. Alright, now so basically if you were to, this is basically the level. So here what can you see? you can see in the cross section there are two arches, right? One is this particular and one is this particular arch, right? So what are these two arches? I'm sure the left one, you can tell clearly that this is the arch of aorta, right? Earlier when we had a higher section, we saw these vessels, right? These vessels, but now we've gone to a section below, which is this particular section, which has the arch. Okay, so the vessels were above. Now what is the arch which is present onto the right side? This particular arch, what is this? So for that, let's move on to a different slide. Okay, so this is what I was talking about. I have you can see on the left lower corner here the AP film that we had just seen, and I have drawn the section with this purple line, that this is where we've cut through. Alright, so now on the left side, I told you that we have the arch of aorta. So you can see in the left lateral view over here, which is in the right upper corner, this is the arch of aorta, right? And this is what is being seen over here. What about the left side? The left side, you can see, is that the azygous vein is ascending up, it is forming an arch and draining into the superior vena cava, right? So this basically down here is the azygous vein, and this basically is the superior vena cava, and the azygous vein is draining into the superior vena cava, right? So now I told you that the azygous vein ascends up from the abdomen, right? It moves up from the abdomen. So, and this is the arch level. So obviously if I were to study a section which was above this level, like the previous section we had done, we couldn't see the azygous vein there. Why? Because it forms an arch below that level, and then it does not continue up. It drains into the superior vena cava. That is why in the previous section we did not see the azygous vein, but now as we've moved a section below at the level of the azygous vein draining into the superior vena cava, we are able to see it. Okay, then and also when we move in the lower sections, definitely we would be like, if we are here right now if I move to the lower section, I'll see the azygous vein, I'll see it as a round cross section, and not as this elongated draining one, because that this is at this level only. So apart from these two arches, what else can we see? The similar thing, the trachea, and behind it is the esophagus, right? The muscular structure. So this is the trachea and this is the esophagus. Okay, now let's go on to a section below. The first section that we had studied about was somewhat here, then the next was somewhat here, now we are somewhat here. All right, so if this is the section, what are the structures that you see over here? If I go from right to left, let's see, the left brachiocephalic, the right brachiocephalic combining to form, this is the superior vena cava, right? So basically this is the superior vena cava. So here this is the superior vena cava. Then left to that we have the ascending aorta going up, right? So this next to it is the ascending aorta. All right, the aorta, we know that it will form an arch and then it will descend. It's present posteriorly, that is why we're not able to see it in the above image. But here, so basically this is the ascending aorta, it was forming an arch above, and now this is the descending aorta, right? This red thing over here is the descending aorta. So the descending aorta, it runs in quite a close relation to the vertebral body. This is the vertebral body. So it runs quite in close relation to that, and you have to note that the ascending aorta basically is in a bit, it's right in comparison to the descending aorta. Okay, so what else is there? Let's move to the next thing. this structure. What is this? This is the pulmonary trunk, which is arising from the right ventricle. Okay, so this is the pulmonary trunk, right? And the pulmonary trunk, basically, after being given off from here, it will divide into a left and a right main pulmonary artery. So similarly, this is the main pulmonary trunk, and this dividing into a left and a right main pulmonary artery. All right, now also here you can see that trachea, basically you can't see it over here, but at this level the trachea also divides into the two main stem bronchus, which you can see over here. One is this and the other is this, right? The left main stem bronchus and the right main stem bronchus. All right, we won't go into the detail of the bronchus anatomy, because that's a detailed discussion which we'll do sometime later. Then the esophagus, it runs as it is, because that does not have to divide anywhere. It goes like a single tube into the abdomen, so it will be the same throughout. Okay, now there are two other things which we have to study now. What are these? So if we study this slide, we can see I've spoken about the major things. Now the main thing that I want to tell about is the azygous venous system. So we have the azygous vein here on the right side. So we saw that it was in the above section, we saw it draining into the superior vena cava, and I told you that in a section below, so basically the before section was somewhat here where we could see it draining there, and now the section is below. So in this section we see it as a single vessel circular cut section. And what about on the left side? If this is the azygos, what is this vein over here? This is the accessory hemiazygos. Remember, we are still at a higher level, so it's the accessory hemiazygos, and when we go at level below, we'll see the hemiazygos then in the place of accessory. So this is the accessory hemiazygos, this teeny tiny vessel, difficult to spot. Here is the accessory, and this is the marked it again wrong. This is the azygos. All right. Okay, so now we've moved on to the lower sections. Now this section is basically cutting through the heart, and we can clearly see all the chambers of the heart. Now starting off, this particular blue structure, what is this? This is the superior vena cava, and we know that the superior vena cava opens into the right atrium, so this must be the right atrium, right? Then here we have the right ventricle, and this very muscular structure is the left ventricle. Now an important thing is that the left atrium basically is the posterior most chamber of the heart. Right, it's placed posteriorly. So apart from that, we can see that behind all these chambers, now this particular thing, this muscular thing, is the esophagus. Now where did the trachea go? So we had seen that in the above sections the trachea had already bifurcated into the right and the left mainstem bronchus, and they've basically entered the lungs. Okay, you can see the branches of the left mainstem bronchus over here and the branches of the right mainstem bronchus. So they've entered the lung. Now they are no more a part of the mediastinum, so basically we won't be discussing them here. And then another important thing that we can see over here is this red structure. What is this? This is the descending aorta, definitely. Now basically, why can't we see the ascending aorta? Because we saw it in the previous section that the ascending aorta had already been given off by the left ventricle, so that we cannot see in the sections below. But the descending aorta has to go and enter the abdomen as well, so this will be visible throughout the mediastinum. Okay, now the other important structure here is the azygous venous system. So basically, if I were to draw a section over here somewhere. So what would I see? I would see the azygous vein on the right side, as you can see over here, this particular thing. And I told you that in the below sections we have the hemiazygous. So this is the hemiazygous, right? So this particular vein is the hemiazygous, and we can see it draining into the azygous, right? So this is the hemiazygous ascending up and draining into the azygous. So the section must have been taken at this particular level where it is draining. Okay, that is why you can see this. Okay, so this basically is just a coronal section of what we've already studied. Coronal section, I hope you all know, what a coronal section is. So basically, if I were to imagine, if I were to, maybe this is a knife. Fine, just don't comment a lot on my drawing. But okay, and I were to move the knife down like this and cut this basically chest into an anterior half and a posterior half like that. All right, this is the sharp edge of the knife. Okay, this is the sharp edge of the knife, and I'm going down as it is, slicing it down. Okay, it sounds very sadistic, but yeah, okay, fine, but you have to do it. You're slicing it down, and you're opening it up, and this is what you'll get. Okay, so this is the coronal section. And just so that you understand that the gross anatomy actually is very important before directly jumping onto the CT anatomy, because it will help you definitely. The CT anatomy, now after studying the gross anatomy, it would be better for you to understand, and it will definitely help you. So just as a correlation, I've kept one of the CT coronal cut here as well. Now let's see what are the various structures that we are looking at. So let's start off with, maybe, okay, this is the left ventricle here, this was the left ventricle here, okay, and here this is the left ventricle. Basically this is the left ventricle here. Okay, now we know that the left ventricle gives off the aorta. So this is the aorta that is given off here. See, you can see that this is the aorta that is given off here, and here you can see that this is the aorta that is given off here. All right, now we know that the aorta, the arch of aorta, divides into 3 branches, right? Here you can see that one is this left subclavian artery, then is the left common carotid and the left brachiocephalic, which then further divides into 2. Then we can see further, we can see that the arch of aorta, it gives off 3 branches, which is the left subclavian artery, the left common carotid, the brachiocephalic, and the brachiocephalic divides into the right common carotid and the right subclavian artery, right? If we see it over here, we can't see in this particular section, we can't see all the branches. We can maybe see, this is the brachiocephalic trunk which we are able to see. All right, but on the CT section here you can see, because basically, see, these are all interrupted sections that we are seeing, but when we go on to the CT, we scroll it down, right? So we see it as a continuous flow. So they might, these sections might vary, a millimeter or so. So that is why in one of the view you are not able to see the subclavian artery, but you will say that you can see it over here. So the difference basically is because of that they are varying a bit in millimeters, and but when you scroll down through a CT, it will be like a continuous flow, and that's much better actually. So coming down here, we saw the brachiocephalic trunk over here. All right, so what are the branches here on the coronal section? So left ventricle, ascending aorta, arch of aorta. Fine. Now here also you're not able to see the left subclavian artery, but you can see the left common carotid here going up. Okay, and then this is the brachiocephalic trunk, which then divides into, this is the right common carotid and this is the right subclavian artery. Alright, so we've done the arterial. Now let's do a bit about the venous. So we know that basically this is the left subclavian vein and this is the left internal jugular vein. This is the right, and this is the left brachiocephalic, the right brachiocephalic, and they combine to form the superior vena cava. Okay, so here if you see on the left side, this is the, yes, the left subclavian vein. All right, this here is this one, left internal jugular. What is this? This is the left external jugular. We're not discussing the external jugular actually over here because it's not, a part of the mediastinum. So, but definitely we'll study it later. Okay, so we saw that the left subclavian vein, the left internal jugular, they will combine and form the left brachiocephalic, right? So we can see it over here. Basically, now on the right side, we can see that this is the right subclavian vein, and it's difficult to point out the rest, but we know that on the right side we have the right subclavian joining the the right internal jugular, forming the right brachiocephalic, which then joins with the left brachiocephalic to form the superior vena cava, which then enters into the right atrium. So basically this here, superior vena cava, right? So basically this is the superior vena cava. Here it's this structure and it enters into the right atrium. So this is the right atrium here. This is the right atrium here. So basically this is the right atrium and this is the superior vena cava, which is entering into the right atrium. We cannot see, the branches above. Okay, so one is this. Then also here we can see, I told you that the right ventricle gives off the pulmonary trunk, right? So here also this is the pulmonary trunk. So here this is the pulmonary trunk. Okay, okay, so now let's just do a very quick revision. Which of the vessel is this? Yes, left brachiocephalic vein. Which vessel is this? Yes, the right subclavian vein. Which vessel is this? Yes, take your time. Yes, the left common carotid. What structure is this? Yes, the pulmonary trunk. What structure is this? Yes, the superior vena cava. Wonderful. What structure is this? A hint? Look at what it's giving. It's giving the pulmonary trunk. So what is it? Yes, the right ventricle. Which structure is this? Very good, the left ventricle. Which structure is this? Yes, the atrium, the right atrium. Which which artery is this? Very good, the brachiocephalic trunk. Amazing job, guys. Let's move on to the next slide. Which vein? All right. Which vein is this? Yes, come on. Amazing. Accessory hemiazygous. It's up, remember? So A comes before, so that's why accessory is above. Which is this? Yes, the hemiazygous. And what structure is this? Yes, the superior vena cava. Which vein is this that is draining into the superior vena cava? Yes, the azygous vein. Amazing. Okay, now let's come on to the different slide. This is, which view is this first of all? Whom do you have to remember? Yes, you have to remember Brad Pitt. Amazing. Anterior side, posterior side. This is the right side of the patient. So this is the right lateral view. Okay. So quickly, what structure is this? The muscular structure. Amazing. Esophagus. The one in front. Yes, the trachea. What structure is this that is coming from the abdomen, forming an arch and draining here? Yes, the azygous vein. And what is it draining into? This particular vein? Yes, the superior vena cava. What structure is this? Yes, the right mediastinum bronchus. What about this? The right main pulmonary artery. And these two structures? Yes, the right pulmonary veins. What is the important thing to remember about the bronchus and artery over here? That they are present at the same level on right side. Amazing, good job. Let's move on to the next slide. Okay, now let's move on to the next slide. What view is this first of all? The left lateral view, amazing. Remember Angelina Jolie? She was facing this side. All right. What's this big structure? Yes, it's the aorta. What's this muscular structure? Amazing. The esophagus. Now, let's see something very minute. Come on, tell me what vein is this particular vein? Yes, the left superior intercostal. And where is it draining? Into this vein. Which vein is this? The left brachiocephalic vein. Is it hard now? Not at all. What vein is this? The accessory hemiazygous. What is this? Yes, the left pulmonary artery, the left mediastinum bronchus, the left pulmonary veins, and the important part to remember here, that the artery is present above the bronchus. All right, a quick revision of the cross sections. Come on, quick. What is this? You have to say the full thing. Which side of the lung is it? It's the left lung. What about this? The right lung. All right. What is the anterior side and what is the posterior side of the patient in this section? Yes, this is the anterior and this is the posterior. Which is the right side? Yes, this is the right side. This is the left. All right. Which is this vein over here, blue structure, elongated? Yes, the left brachiocephalic vein. What about this? The right brachiocephalic. What about this structure? Yes, the trachea. And this, the esophagus. What are these three structures? Yes, these are the three branches of the arch of aorta. Let's name them from left to right. What is this? The left subclavian artery, very good. The left common carotid, and this is the brachiocephalic trunk. All right. All right. What structure is this in the center? Yes, the trachea. What arch is this on the left side? The arch of aorta. What arch is this on the right side? This is the azygous vein draining into what? The superior vena cava. Amazing. What structure is this? The esophagus. Let's move on to the next slide. What structure is this? Yes, the ascending aorta. What about this? The descending aorta. What about this? The superior vena cava. and this, the main pulmonary trunk, the left pulmonary artery, the right pulmonary artery. Amazing. What about these two structures? Yes, this is when the trachea is divided into the right and the left mainstem bronchus. What about this structure? This is the esophagus. All right, now the important thing. What is this particular vein? Yes, the azygous vein. It's on the right side. And what about this particular vein? Yes, the accessory hemiazygous. Good job, guys. All right, quickly, let's look at this heart chambers over here. What chamber is this? The right atrium. What can you see entering into it? The superior vena cava. What is in front of the right atrium? The structure, the right ventricle. What is this structure, which is very muscular? The left ventricle. And what is the most posterior chamber of the heart? The left atrium. All right. What are these? These are the pulmonary veins which are opening into the left atrium. What is this particular structure? The esophagus. Where did the trachea go? The bronchus has divided, so there is no more a trachea running in the mediastinum. What artery is this? The descending aorta. What vein is this? The azygous vein. What vein is this? Hemiazygous. And what is it doing? It's draining into the azygous vein over here. All right. Quick revision of this particular slide. What is this? What is this? The superior vena cava. What is it draining into? The right atrium. Good job. What is this? This is the small thing. This is the right ventricle. I told you it forms the base, right? What is this? The very muscular left ventricle. What does it give rise to? Here, the aorta. What is this? The main pulmonary artery. All right, what about this? The left subclavian vein. Amazing. What is this? The left internal jugular vein. What is this? The left brachiocephalic vein. What is this vein? This is the left external jugular. I told you that it's not a part of the mediastinum and we're not discussing it in detail. But what you have to remember, the two most important are the left internal jugular and the left subclavian, because these two are the one which combine to form the brachiocephalic. The external jugular basically drains as a separate vein here. All right. Okay, so I think and I hope that you people have understood the gross anatomy, and if you've got most of the questions right in the revision part, you can safely move on to the anatomy of the mediastinum, the vascular anatomy of the mediastinum in the CT. You can move on to that video, and if you weren't able to get enough questions right, you might want to revise it once. And don't worry, it is actually quite a complicated thing. It'll take time to understand, and I'll see you in the next video of the CT anatomy. So I would like to thank everyone for watching this video. So the purpose of this video was to orient everybody about the anatomy of the mediastinum, so that when you move on to the CT anatomy now, you can understand it better. You don't have to mug up things there, because you'll already have an understanding of the subject through this particular video. So I think it would definitely be of a great use to you, and I'll see you there then. Thank you.